Alright, so we're getting ready to talk about artificial insemination and embryo transfer. And these two systems of mating rely heavily on estrus synchronization. And there are a variety of synchronization protocols out there. And depending upon who is providing your artificial insemination and embryo transfer services as probably to which one that they prefer to use. So some of that may depend upon your setup. It may depend upon your experience at giving the hormones that are used in the synchronization protocols. There's several factors that go into deciding which synchronization protocol is right to use for the program. There are natural hormones and there are synthesized hormones that can be used. Basically what you're doing with these is you're using the hormones to basically fool the body into cycling when it was probably not in the time frame for them to cycle. It doesn't hurt them. It just helps cycle the system maybe a little bit faster than what it would have done naturally. So for your synchronization protocols, we can go through and talk about them. I'll include in the list of resources some information about your artificial insemination and embryo transfer, which we'll talk about synchronization protocols. The best bit of advice I would give is get with whoever you intend to contract these services through and talk to them. That way you can set up and utilize a protocol that will work for them. Because the idea of it, if you're doing artificial insemination and embryo transfer and you're paying the money to actually go out here and do this, then you want to be able to get the most bang for your buck. You want to have as high a success rate as possible. So our next breeding system is artificial insemination, and this is normally referred to as AI. This is a process by which semen from the male is placed into the reproductive tract of the female using mechanical means rather than by natural service. Process for this, he'll go out and collect the sire, he'll collect the semen from them, which is usually done and collected with an artificial vagina. Semen, it can be either fresh, frozen, or stored. To actually do the artificial insemination, you have to be able to detect when the female is in heat. A lot of producers, if they're doing artificial insemination, will use a hormone protocol to bring them into heat and so that they know when they are ovulating. That way they're not wasting the semen. And with this system, the semen is introduced into the uterus. Advantages of artificial insemination include decreasing spread of disease, increase the number of offspring from a superior male, identifies the fertility of the sire, reduces the number of sires needed, and allows the mating of small females to large males. Some of the disadvantages of AI: it requires trained level of management, increases time and supervision of the female herd for estrus detection, does require a little bit of training of the sire for collecting. Semen handling and special breeding facilities are needed, and this system is typically more costly. and you tend to have a loss of genetic diversity in this type of a system. So our next type of mating system is embryo transfer, and it's typically referred to as ET. And with this type of system, you're going to go through and remove embryos during the early pregnancy from a genetically superior female, and then you're going to take those embryos and place them into the reproductive tract of a suitable recipient for gestation and paturation. The process for this, you'll select a donor, and this is generally a genetically superior female that you're wanting to take advantage of the genetic material of that female. The donor will undergo superovulation. This is through hormone use. With superovulation, typically what will happen is multiple follicles develop on the ovaries, resulting in several numbers of eggs. With sheep and goats, you'll typically see between 10 to 20 follicles. You may have more, depending on how great of a donor you have, but probably the average between 10 and 20. And then your donor is properly inseminated, or AI'd, around 5 days after superovulation. The embryos are recovered by a process of flushing around 7 days after breeding. And you want to make sure that you have a recipient or surrogate that's been selected. Typically, for your recipients, you're going to want animals that are great mothers. They produce a lot of milk and great maternal instincts to carry these embryos from these high-dollar donors. The embryos are then transferred to the recipient, and they can be either fresh or frozen and thawed. The embryos should be placed in the uterine horns. So the advantages of embryo transfer: it typically results in greater use of genetically superior females. It's a fast way to acquire offspring for progeny testing, and allows females with long gestation periods to meet their genetic potential. Some of the disadvantages of this type of system: it requires highly trained management, increases time and supervision of the female herd for ovulation and estrus detection, and you need typically a special lab and breeding facilities, and overall is generally more costly. So depending upon what the goals of your breeding program are and who your customers are, as to what system will actually work out better for you.